Good afternoon. My name is Joyce Coleman. I'm the Executive Director of the Vasculitis Foundation, and I'd like to welcome you to today's installment of the VF's Roadmap to Wellness webinar series. Today's topic is Back to School with Vasculitis, managing your drugs, treatments, social life, doctor's appointments, and oh yes, your classes. We will be conducting a Q&A session after the presentations. If you have a question, please submit it through the question portal. Kaylin Young, the Network Manager of the VPPRN, will be moderating the Q&A session and will be gathering the questions throughout today's webinar. I am pleased to welcome Dr. Philip Seo and Ms. Brittni Riemer to the webinar. Dr. Seo is an Associate Professor in the Division of Rheumatology at Johns Hopkins Medical Center, a graduate of Harvard College and the College of Physicians and Surgeons at Columbia University. Dr. Seo completed his internal medicine training as a member of the Osler Medical Service at the Johns Hopkins Hospital. Since then, he has worked at Johns Hopkins in several capacities, including as a hospitalist at Johns Hopkins Bayview Medical Center and as an Assistant Chief of Service of the Department of Medicine at the Johns Hopkins Hospital, before joining the Division of Rheumatology. He now serves as the Director of the Johns Hopkins Vasculitis Center and Director of the Johns Hopkins Rheumatology Fellowship Program. Dr. Seo is also a longtime member of the VF Medical Consultants and Scientific Advisory Board. We want to thank him for his many years of service to the Vasculitis Foundation and to our patients. Our second speaker is Ms. Brittni Riemer. Ms. Riemer, now 23 years old, was diagnosed with microscopic polyangiitis, MPA, at the age of 13 and had one flare-up in 2010. The Middle River, Maryland resident has otherwise remained in remission with the help of medications. A former cheerleader of 10 years who leads a very active lifestyle, Brittni has just graduated nursing school this past May. She is a registered nurse with her associate's degree and will begin studies at Notre Dame University this fall for her bachelor's degree. We'd like to thank both of you for speaking today, and Dr. Seo, I'll turn the floor over to you now.
So hi everyone, as you just heard, my name is Philip Seo and I work out at Johns Hopkins, and I'd like to thank the Vasculitis Foundation for giving me this opportunity to speak to all of you today. And I'd also like to take this opportunity to apologize to the Vasculitis Center for giving them such a long-worded introduction, because I was asked to provide a biography for myself, and I realized that even though everything you just heard about me is accurate, none of it actually has to do with why I'm speaking to you today. Because the real reason I'm speaking to you today is because I'm an expert in college. So I went to a sleepaway college in Massachusetts, even though I grew up in New York, where I spent 4 years of my life sleeping in a bunk bed in a room that was way too small for 4 guys. I hiked to classes in 12 inches of snow and then fell asleep during morning lectures about chemistry and about physics. So I know all about college, and I know what you're about to go through, and I think I can help. So the first thing I want to do is I want to tell you a little bit about my perspective, because I know when I talk to college-age students about their future plans, frequently they tell me about their summer internships or what they're going to do in the next couple of years, or even after they graduate, if they're heading towards, say, graduate school or other big plans. And yet that's not what I'm thinking about when I talk about long-term, because when I talk about long-term plans, what I'm thinking about is what you're going to look about in the next couple of decades. I'm thinking about you falling in love and getting married and walking down the aisle and having kids and grandkids, and because I have such a different perspective on your life, you'll find that often I'm sort of the downer at the party, because I'm the person who's going to show up in your life and tell you that you got to take your pills and you got to show up to your appointments, and I'm the person who's telling you all the things that you really don't want to hear. And it's because I think I know where you're headed in maybe the next 10 or 20 years, and I think 10 or 20 years later, like your parents say, I think you're going to thank me for this. But it's the reason why I talk the way I do. Because even though I know what you're saying right now, and I know what you think that you want, I think that what you think you want now is going to change over the years, and I'm trying to predict that as I try to help you get through college in particular. So when I look at your college career, what I tend to tell people is that what you really should do is focus on not making changes. Because even if you're doing great when I see you in clinic, if you're just about to start your freshman year, the big problem from my standpoint is what if you flare? What if you have a flare that knocks you out for like 2 or 3 weeks, just long enough that you can't complete the semester? Well, even though life in your life experience, that's not such a big deal. In the short term, it is, because it takes you out of classes for a while. It means that it's extra money out of your pocket, but it also means that you're out of sync with your friends. Maybe you might not be able to graduate with them at the end of 4 years. And because of that, I think my focus is trying to keep everything calm and quiet. So I tend not to make very many waves when you're in college. So I think what you need to do when you meet with your doctor, specifically right before you head to college, is trying to figure out what you two can do together to make your lives as predictable and as calm as possible. So before you head to college, there's a few things you're going to have to think about, and the first one is vaccines. And the bottom line is vaccines are a great idea. Vaccines are really the reason why so many illnesses like measles and mumps really don't exist in the United States anymore, and I'm a huge fan. The one type of vaccine that you should think about, because it's not really considered to be standard by a lot of physicians yet, but it probably should be, is the flu shot. So traditionally, we only give flu shot to people as they get older or people who have other problems with their health. So traditionally, people with vasculitis might be the type of people that you might consider to get a flu shot, but I recommend it for everyone. And the reason why is because when you think about communicable diseases, they're most common in places where people are housed together in very close quarters. So there are two situations that really come to mind. It's going to be the military and it's going to be college. So if you're going to get the flu in your age group, it's going to be while you're at school. So you might as well take the vaccine just to make sure that doesn't happen. Now, the type of vaccine that you have to avoid, especially if you're on immunosuppression, is something that we call live attenuated. And for your purposes, that only really means the measles, mumps, and rubella vaccine. And that's pretty standard before you head to college. But if you're taking the medications that I use on a regular basis to treat vasculitis, there's a good chance you're not going to be able to take that vaccine. And you're going to need a note from your doctor just explaining to your school why it is that you can't take it. And don't worry about that, because the fact that all your friends in college are getting vaccinated, that's what protects you. Because if they can't get these diseases, then you can't either. I stuck yellow fever on for those of you who might be entering your junior year and might be thinking about study abroad in Africa. There are certain parts of Africa where yellow fever is a big problem, and you can't visit those areas without getting the yellow fever vaccine. And that's a little bit more of a trick, because that vaccine's a little bit more active, a little bit more of a problem, and depending on what your drugs you're taking, you might not be able to get it. And then it really comes down to looking at exactly where in Africa you might be going and how big of a risk you might have. I want to talk a little bit about follow-up, because a lot of you are going to go to college out of state, and when you do that, you just got to think about how to hook back up with your rheumatologist when you go back home. And just remember that doctors travel too. So if you know that you're going to be at home for about a week in December, then make sure that you call your doc's office at least months in advance and try to get one of those appointments right around the Christmas time when the holidays just start. Because if you don't plan that far in advance, there's a good chance that your doc might be around and you just won't be able to get into his clinic in order to see him. The other issue that you're going to encounter is college for a lot of you is going to be the first time where you're basically running your day-to-day life without any backup, because a lot of you have your parents who know about your medications and your appointments and your drugs and can often help you out. But in college, for the first time, you might end up going to a clinic or going to an emergency department without anyone who really knows you very well. So this is what I suggest. What you should do is sit down with a piece of paper and write down the following. First, you want to write down the name of your diagnosis. You make sure that you're spelling it correctly, please. Then you want to write down what medications you're currently taking and what doses you're taking, because there's a whole lot that a doc can figure out about you just by looking at your current drugs. Finally, you want to put down the contact information for your doctor and whatever contact information your doctor thinks is appropriate, because anyone who works in a large group or works in a university setting like I do, even if I'm not personally available, there's always some doctor who they can get on the phone if they've got questions about you or your diagnosis. The other thing I'm going to recommend is learn something about your diagnosis. Now, I'm a big fan of not spending your entire life on Google, and I highly recommend it, because if you Google your disease, you're going to find out all sorts of crazy stuff that will never apply to your life, and I just don't think that's a good way to spend your time. But I do think you should know a little bit of something about your disease, because frequently you'll be the first patient that another doctor is going to see who has a diagnosis of vasculitis. And I'm going to tell you right off the bat that it's just not a bad thing. You know, you should get used to teaching your physicians about vasculitis, vasculitis, at least a little bit, but mainly so that you can reassure them that whatever it is you're coming into their clinic for doesn't have anything to do with it. Because I think that if you think about the reasons why you might end up in a clinic while you're at school, 90% of it has nothing to do with a vasculitis diagnosis, and the vast majority of it doesn't even have anything to do with the medications you're currently taking. So you arrive at college, you're unpacking your stuff, you've got your fridge set up and your TV, and the question is, what should you be thinking about now? And the first thing we're going to ask you to think about is hygiene. Yes, hygiene is a great idea. Hygiene is also one of those things that's a little bit hard to achieve at college because college is a sharing experience. You're going to find that people don't necessarily respect a lot of personal space because in college there's often not a lot of personal space to be had. So taking a bite of your sandwich or taking a sip of your drink or sharing your lip gloss, if that's the sort of thing that you do, all those things are widely permissible among most social circles, and you might have to tell people to back off just a little bit, especially if they look like they might have an infection or you don't know them so well. What I tell people who are on immunosuppression is that you should expect one cold additionally once a year, and you should expect it to linger for maybe 3 to 4 weeks longer than you really think it should. And I'm going to tell you that that cold is headed your way no matter how much Lysol you use. So you can go ahead and spray everyone and everything down if you like, but I can tell you right now you're going to get the same cold, and it's just going to make you even more bitter and upset about it because you're going to feel like you didn't deserve it. So I'm going to tell you, don't be paranoid about that sort of thing. Don't be one of those people who shows up at the cafeteria and wipes everything down before you sit down. But I will tell you that hand hygiene is particularly important because what you want to do when you're around people is you want to make sure that if you touch someone who's sick that you don't touch your face because that's how you give yourself a cold. So what you want to do is if you're shaking someone's hand and you think they might be sick, just keep an eye on where your hands are, make sure you don't accidentally touch your face, and when that person walks off so they don't feel so funny, just take out a little bit of Purell and wipe down your hands, and then that takes care of 90% of the problems that you might have. Now, I will say that it would be a good idea if you don't sit right next to someone who's actually infected. So if your best friend has a cold, just tell them to sit someplace else for a few days until they clear it. That's the main way that most people will give you a cold. Either they'll touch you or they'll cough on you. Other than that, these germs don't really jump from person to person. So in general, in most open settings where someone is sick but only in your vague vicinity, it's just really not a problem for you. Sleep is also another good thing in college, and sleep is the one thing that you're not going to get a whole lot of because you're going to notice that it takes you away from all the things you went to college to do. You're going to get a lot more out of college if you're awake to actually see it. And what you're going to find is that sleep is better when it's predictable. So if you know that you're going to go to sleep at 11 o'clock every night and you're going to wake up at 8 o'clock every morning, your body will deal with that sleep much better than it will if you just get 8 random hours during the day, depending on when you've got a break. Your body really craves predictability, and a predictable sleep schedule will make that sleep work a lot better than just random hours of sleep during the day, even if they add up to the same numbers. I'm also going to tell you, don't feel obligated to keep up with your friends. You might find that your friends have a little bit more energy than you, and that's fine. Just know when you need to take a break and learn to listen to your body. Energy level is something that comes up a lot, and my big recommendation to you is learn to exercise on a regular basis. There are a lot of changes that happen during college, and one of them is that it's the time that you really want to train your body to get exercise on a regular basis. That just sort of living and breathing probably isn't enough to keep your body in good shape. And one of the tricks is to exercise in a group. Now, if you like team sports are great, and colleges are famous for team sports, but even if that's not your thing, if you find at least one other person who likes to exercise or is committed to exercising as part of a New Year's resolution, that's terrific too, because it sort of inspires you to not skip sessions. I'm also going to say that exercise is a great way to combat fatigue, that even though this doesn't necessarily make intuitive sense, the more you stress out your body now, the more prepared your body will be to handle stress later. I also want to mention that variety is good, so you don't have to do exactly the same routine every single day, and that mixing it up a little bit is actually pretty good for you. And one of my colleagues wanted to point out that yoga is also great. Not everything has to be an NCAA sport when it comes to getting exercise, and yoga, Tai Chi, that sort of thing is also a great way to keep your body in shape. I wanted to mention about nutrition. This is not rocket science. If you think it's bad for you, it probably is. Remember that packaged foods, anything that's going to come in cellophane or in some sort of foil, remember that some scientists spent millions of dollars figuring out how to get you to eat more of it, which is the reason why Doritos taste so good and it's so hard to put them back on the shelf. Also think about what your mother would say when you're eating food. So if you're going for an extra large slice of pie, just think about what your mother would say about it, and that's a pretty good guide to what you should be putting into your mouth. That's another way of saying that remember that one of the problems that you have with food is not so much what you eat, but how much of it you eat. So it's okay to have desserts and carbs and whatever. You just have to watch how much of it you take in. The other thing you need to look out for is the late night snacking, because it's a rite of passage in college to be up at 1 o'clock in the morning studying for finals and downing half a pizza. And once in a while, I think, it's just the way it is. But I think that in general, you just have to make sure that you look out for the carbs, because what you don't want to do on a regular basis is eat a lot of carbohydrates and then fall asleep for 6 hours, because what's going to happen is all those carbohydrates, while you sleep, they turn to fat. And it's one of the reasons why freshmen in particular are so famous for gaining weight during that first year. One issue that often comes up, especially when it comes to medications and appointments and that sort of thing, is you're just going to forget. And the reason why you're going to forget is because you're busy, because you now have all this other stuff in your life that you have to keep track of, and appointments and medications and such are just one small part of it. So I'm going to tell you right now that the less you rely on your memory to remember how to do things or remember to do things, the better off you're going to be. And I'm a big fan of all this electronic stuff that's around that's completely free to you. For example, I use Google Calendar. And the great thing about that is you can set it up to put in your appointment with your doctor so you remember what it is, and then you can set it up so it emails you a reminder, say, 3 weeks out, so that you can remember to call the doc for prescription refills, for example, or whatever else you need on a regular basis. There's also these great to-do lists that you can download onto your iPhone or to your Android phone. The app, Remember the Milk, is probably the oldest one. The newest one in the group is probably Asana. Remember the Milk is the easiest. Asana is probably the most complicated, but you could try them both out and you could see which one works for you. But it's a great way to be able to write things down when they occur to you and then just not have to worry about it, because you've got now something electronic that's going to be your portable mind that will remind you when you need to do certain things. So medications are particularly important because you're going to find that at least once in college you're just going to run out of your medications because you're just not paying attention, because it's finals, because whatever. And this is what I'm going to suggest you do. This picture over on the left-hand side of the screen, that's a pill box, and you need one. And the reason why is because this pill box is going to help you get through college. So what you're going to do is you're going to make sure that on a regular basis you keep this in your book bag. And the reason why is because of the times that you're going to forget to take your pills, or the times that you just wake up 5 minutes before the class starts, you're going to grab your books and you're going to run, and then you're going to realize in the middle of class you didn't take your pills. But because you keep your pills in your book bag, they're already with you, and you can just down the pills while you're sitting there. And I think that's a nice way to remember where your pills are, and also to have them with you at times where you probably are going to need them. What you want to do is every Sunday night you're going to sit down with your pill box, you're going to fill them up. You're going to fill it up with all the medications that you need to take during the week, and then you're going to take a look at your bottles. And if you realize that you don't have enough pills to do that again next week, that's when you need to know you need to call for a refill, because that's going to give you about a little bit over a week time in order to get the refills in place. I will say that mail order pharmacies are terrific because they will send you 90 days worth of prescriptions and they'll just mail it directly to your house. So you don't have to worry about any of that stuff. So if you can set up a mail order prescription, that would be great. Now you do have to have storage space for all those pills, but that's normally not so bad. Okay, so despite all this advice, you could do everything that I say. You could try really, really hard, and there are going to be some times where you just mess up. And the question is, what do you do then? So let's say you run out of your medications. This is what I think you should do. Go to your local pharmacy, bring your empty pill bottles, and then do something crazy. Tell them the truth. Tell them what happened. Tell them you just messed up, that you forgot to get your medications filled, whatever. Pharmacists actually have a bit of leeway, and they can give you a refill of their medications for like 2 or 3 days until you can get in touch with your doctor and get a prescription through the normal routes. Now, let's say you forgot to take your pills. Let's say it's later in the day and you suddenly realize that you forgot to take your morning medications. Well, if it's a medication that you're supposed to take every single day and it's less than 12 hours has passed, so it's not even noon, go ahead and take the pills. If it's a medication that you're supposed to be taking twice a day, then just skip that morning dose and just resume in the afternoon. That will be fine. Now, let's say that longer than 12 hours has passed. So let's say it's a day afterwards, and that's when you realize that you forgot to take your pills. Well, for most medications, it's okay just to pick up where you left off. Most of these medications have a little bit of a honeymoon period, so you could skip a dose once in a while and nothing's going to happen. Now, I will say that if you're taking a medication like methotrexate, where you have to take the medication once a week, then you just want to take the medication anyway on the day that you remember, and then resume your normal schedule the week after. Routine's really the most important thing. I'd rather you stay on a routine and not deviate from it, rather than worry about exactly 7 days elapsing in between doses. Okay, so let's say you get a bad cold, like not bad enough to send you to a hospital, bad enough that's getting in the way. What can you do? And my first statement is anything over the counter is fine. So you go into the CVS or to the Rite Aid and you see a package of Dayquil or NyQuil or whatever it is they sell. All that stuff is fine for a few days. Now I will say that most of these formulations do contain Tylenol. Now the chemical name for that is acetaminophen. And if you look at the back of the package, you can actually see if it contains it. But the easiest thing for you to do is just to avoid it. So if you are taking one of these over-the-counter cold remedies, just make sure that you're not also popping Tylenol at the same time, just to make sure that your body's not getting 2 doses of the same drug at the same time. A lot of you are going to be on antihistamines, especially during the spring and summer, and that means drugs like Claritin, Zyrtec, and Allegra. And the thing to remember about that is that even the ones that are called non-sedating, like these drugs that I just named, even they can cause you to become a little bit sleepy. So maybe they're not the best medications to pop early in the morning when you just first wake up and you're still trying to get to class. You might want to put that off till later in the day. Now, Afrin is a great drug that works really well to clear out your sinuses when you have a bad cold, and I'm going to tell you to avoid it as much as possible. And the reason why is because Afrin is associated with a nasty rebound effect, where 3 days later, if you're taking it, all of a sudden you're going to notice that your nose congestion becomes a lot worse. And when that rebound occurs, it doesn't really respond to anything. So you're better off trying to avoid the drug as much as possible, even though it does work really well. If your nose gets congested like that, I'm going to recommend a neti pot, which you can put onto Google and you're going to find on YouTube, and you're going to see all sorts of videos of people using neti pots in order to clear out the sinuses. I will say that I use it when I get sick, and I think it works a lot better than a lot of the medications you can take by mouth. Remember, when you're sick, you're going to be dehydrated, and a lot of you are going to be thinking about Gatorade, which is fine, but you also want to be thinking about salty fluids, and the best salty fluid out there is going to be chicken soup. So if you can get some chicken soup from the local takeout place or from a can, that would be one of those things that's actually going to make you feel better. Mother was right. For those of you who can't get chicken soup, ramen, another salty fluid, is going to work just as well, and you're probably going to have it someplace in your dorm room. Life in college is stressful, and the question is, how do you deal with all the stress? And I'm going to make you some suggestions. So the first one is attitude. And believe it or not, how you feel about your life actually determines how you're going to respond to it. So if you go into life thinking my life sucks, then your life will suck. Having a positive attitude is actually a huge part of coping, and it's something that it's worth thinking about, because if you can change your mind about how you feel about your position and your life, you can actually change the way that your body responds to stress. Physical activity is a great stress reliever. I have a patient who plays rugby, and when I asked him why, he said it's because the only socially acceptable way he can hit people at a regular basis. You don't have to hit people in order to get a physical relief, so anything that makes you break a sweat is going to relieve stress. Sleep is also real important when it comes to dealing with stress. When you're sleep deprived, you're going to find that everything is going to feel a little bit more stressful than it really should be. Healthy relationships means more than just dating. It means that you should surround yourself with friends and family who make you feel good about yourself and who support who you are. Time management is important. That a large source of stress when you're in college is going to be forgetting about that deadline until 3 o'clock in the morning when you suddenly realize that paper is due tomorrow. And again, by using these calendars and these online reminders and trying to break down assignments into doable parts, that's a big thing that I didn't learn until really late in life. All those things are really important to reducing the amount of stress that you're going to experience in college. Money management is also important. Money is a huge source of stress. Just make sure that when money leaves your wallet, you know why it's leaving your wallet, and you know how much is left. And finally, spirituality. Not necessarily organized religion, but however you feel about spirituality. If you keep that part of your life while you're in college, you're going to find that life is a lot more livable. Now, let's say that's not enough, because once in a while, for some of you, it's not going to be enough, and you're going to need to reach out to some other people. The first thing I'm going to tell you is don't go it alone. Now, we all know that college is stressful, and stress is one of the biggest complaints that students have when you ask them how they feel about their college life. The thing that you want to know about college in particular is that campus mental health is a big deal, that all colleges have some sort of mental health program, and the mental health programs are confidential. So don't think that anyone's going to ever know that you actually went to one of these mental health programs. So they're there to be used, and you should definitely use them. I wanted to mention that the link on the left-hand side, that is a link to the website that's maintained by a college that has an entire section on stress management. I think it's a great resource, and it might be worthwhile for you to go through at your leisure sometime later in life. One question that comes up is what to tell your friends, because when you're in a dorm room, people live on top of you. They're going to see that you're taking medications on a regular basis. You got to tell them something. And sometimes it's just enough to tell them that you take some pills on a regular basis because you got a diagnosis, and that might be it. But for people who are a little bit closer to you, or you want to tell them a little bit more, this is how I would describe vasculitis. I would just tell them that your immune system is hyperactive. Just like a kid with ADHD that's bouncing off the walls, your immune system is bouncing off the walls. And because it's doing that, it's causing all sorts of problems. And you can keep those problems under control just by taking some medications that keep it a little bit more regulated than it wants to be. So you're just trying to slow down your immune system just a little bit. It's important to tell people that your diagnosis is not contagious because, believe it or not, some people are not going to know that. They're also not necessarily going to know that these drugs that you're taking are not a problem for them. So you can let them know that you can't transmit these drugs through spit or through sweat. All sorts of crazy thoughts come through people's heads, and just let them know right off the bat they don't need to worry about it. They also need to know that your biggest problem on a day-to-day basis is remembering to take your pills. So if you look good, you are good. There's nothing in particular they need to be worried about. They don't have to handle you with kid gloves. They don't have to be worried about exposing you to certain things. That for all intents and purposes, as long as you feel good, you're a perfectly normal person. So for this part, I wanted Brittany's help. So I wanted to tell you a little bit about how clinic feels when I encounter a teenaged patient. So this is a scene from a rheumatology clinic anywhere in the United States. The characters are typical teenage patients who will be played by Brittany, and then a rheumatologist who will be played by me. So I start, and I say, what medications are you on? Brittany?
Imuron and prednisone.
Are you taking your medications?
Yes.
Is that a question?
No.
So you are taking your medications?
Yes.
Every day?
Well.
Okay, and this is my way of saying, when you see your doctor, be forthcoming. Don't make your doctor work for information. Just tell them what's going on. And in particular, when your doctor asks you, are you taking your medications, they mean, are the medications actually making their way into your mouth? If you don't tell your doctor what's going on, they can't help. They might get a little bit irritated that you're not doing certain things, but it's only because they care, because they want to make sure that your disease stays under control. The other thing to remember is that a doctor's not your dad. You don't worry about disappointing them. Don't worry about impressing them. You just got to tell them the truth so they know what to do next. Also, in my experience, the thing that you're the most afraid to tell me is actually something I really just don't care about. So I could probably alleviate a lot of your stress if you just tell me what's going on. Finally, the one thing that I will say is that sometimes you get to the point where you're just not willing to do something. You're not willing to take some pills. You're not willing to go to certain appointments. You're not willing to see certain doctors, and I get that. And you're at the age where you deserve to have a vote in what you do and how your health is run. And I just ask you to make sure that your doctor is a part of that, and make sure that you give them a chance to work with you, because I think that a lot of times what you're willing to do, I can work around. One of the big issues is prednisone and the effect that prednisone has in your body. And I wish I had a good answer for that, because you're going to notice at minimum that prednisone causes you to form these funny bruises, but it also changes the way that your body looks. It's going to make your face a little bit fuller than it should be. It might change your breast size. It's going to cause you to eat a little bit more food, and people are going to notice. And it's hard for that not to mean something to you. And I think when you go to your parents, sometimes their advice is not so helpful, because either they tell you that they love you and don't worry about it, or they tell you to suck it up. And neither of those things are terribly helpful. And I think when your parents say things like that, what they're really trying to say is this. Some people will stop seeing you as you, and they'll start seeing you on the surface, your face, your hair, your body. These people won't care that you're a star at math or that you love to swim. These people will care mostly, sometimes only, about how you look. They'll reduce you to a body instead of seeing you as a person. They'll think that your body is public property. If you insist on expressing your opinions, and I hope you will, they'll hide behind their screens and call you ugly or a slut. If you speak up, they will try to shame you into silence because, and it breaks my heart to write these words, that's the way that some people still think. My prayer is that you'll never lose sight of yourself, all of yourself. You are so much more than your looks. Your body is perfect, perfectly made and perfectly sized. You don't have to waste years of your life trying to fit someone else's idea of beautiful. Love your body for what it can do. Remember that you've climbed mountains, swum in ponds, collected buckets full of clams, balanced on bicycles and paddle boards, and danced around your bedrooms with complete abandon. Remember how great it feels to solve a tough math problem or cook something delicious or fall into a really great book, and how none of this has anything to do with your appearance. Keep swimming, keep talking. If something's wrong, speak up, and remember that every single part of you is perfect. And this comes from a letter that was published in Time magazine. And if you Google this woman's name and the phrase Time magazine, you're going to find it. And I highly recommend that you read it, because I think it's what all of us mean to say when you ask us questions about appearance, and we just can't find the right words. Parents, I know there are a lot of parents on the phone call, and they want to know what you can do to help your kids. And this is the prime thing I want you to do. Leave. The problem is that your kids have questions, and no matter how close you are to your kids, they're not going to feel comfortable asking every single question in front of you. So what works for me is that if you could wait through the history where I finish talking to your kid and you tell me what you're worried about and any concerns that you might have, and then when I get to the physical exam, walk out. And that gives me a chance to talk to your child on a one-to-one fashion, and they can ask whatever questions they've got, and we can work through whatever other issues they might not have felt comfortable bringing up with you. And I will say that when I've tried to kick some parents out, that they've complained that they felt it was inappropriate. And all I can say is that you have a choice. They can either get information from Google or they can get it from me. And I can tell you that I'm just a whole lot better than Google. So speaking of which, for those of you who are actually college age, you have no idea who this is, but this is Marion Cunningham. And for many of us who grew up in my era, you think of this as the prime example of motherhood. And this is a very long way for me to say that I am not your mother. So I'm about to talk about some things that are going to make your parents a little uncomfortable and may get me just into a little bit of trouble. And the reason why I'm going to talk about it is because even though it's not something I'm encouraging you to do, when you get to college, you're going to be exposed to all sorts of things and all sorts of situations. And it's up to you to figure out whether or not you're going to go with it, or if you're going to not do it, or whatever else that works for you. But I think that there's some information that you need to know so that you can do things safely. So all of you are thinking about sex, whether or not you want to admit it, but it's hard not to, especially at your age. So there are some things that you should know that you can't do. You cannot give vasculitis through close contact. I don't care what it is that you're doing, but through kissing or through sex, you cannot communicate vasculitis. You also can't hurt someone through close contact because of the medications that you're taking, so I don't want you to worry about that. You don't transmit significant amounts of drugs through sweats or through other bodily fluids. Remember that you're not more susceptible to sexually transmitted diseases than anyone else, so sex in that way is not less safe for you than it is for other people just because you're on immunosuppression. That said, remember you're just as likely to get sexually transmitted diseases as anyone else, so you've got to take the same precautions that anyone else might. Remember also that despite the fact that these drugs can sometimes be used to decrease the rate at which cells divide, which in your head you might think might prevent you from getting pregnant or making someone pregnant, that's not true. And people get pregnant all the time with these medications, and it's something that you have to keep in mind. So if you're a guy, the best form of birth control that you're going to want to think about is condoms, and it's predominantly because it protects you from sexually transmitted diseases as well as prevents pregnancy. It has a 97–98% effectiveness rate when it's used properly. Remember that most health departments, meaning university health departments, not state health departments, will supply you with condoms for free. You just stop by and you put a few in your pocket. For those of you who don't have a health department that does that or don't want to do that for whatever reason, let me just say that Amazon will just ship it to you in a plain brown box, and you can feel free to order it online along with your books. For women, remember that a lot of these drugs cause birth defects, and it just complicates the issue because not only could you get pregnant, but it's possible it could be a bad pregnancy in that way. Remember also that those of you who are on Cellcept or mycophenolate mofetil, that birth control doesn't work perfectly. And although this is mainly a theoretical concern, it's especially a concern for those of you who don't remember to take your pills every single day. I want to talk about drugs, and I don't want to tell you that all drugs are bad, but I do want to tell you which drugs are a little bit more dangerous, and that includes the following: heroin, cocaine, meth, and tobacco, because they're all highly addictive. They're the sorts of drugs that once you started, it's really hard to get off. I'm going to tell you that Molly is really popular. And the thing to remember about that is that it has high toxicity. So after one dose of Molly, we can already see changes to your brain. And when you're as young as you are, that's a really important consideration to take into mind. Remember that tobacco is a drug that causes all sorts of problems that your body would not otherwise develop if you didn't smoke, so it's another reason to avoid it. Synthetic marijuana is another one. Remember that synthetic marijuana is just literally dried grass where they spray drugs on it that change the way that your mind works. It's about as bad for you as it sounds, and it's dangerous because you never know what the drugs are that they're spraying on the grass. I will say that marijuana is now legal in almost half the states in the United States, so it's even more available on college campuses than it was when I was a student. And remember that the toxicity actually is not that great when you're using it on an intermittent basis. And that's not to say that for those of you who use it on a daily basis, it's not going to cause a problem, because it will. And one of the things that we discovered recently is even though it's hard to see the toxicity after a few doses, for people who use it on a daily basis, it does impair the way that your brain functions, which is probably an important problem for you if you're in college. I will say about alcohol that if you take methotrexate, that you're not supposed to drink at all, and I will say that that's one of the reasons why I tend to avoid methotrexate in younger people. It's also one of the things that I don't expect people necessarily to follow, so I will say that if you do decide to take alcohol and methotrexate at the same time, that you just make sure that you don't take your lab test on the same day that you have a couple of beers. You should know that alcohol can make skin vasculitis flare, and again, it's not something I want you to worry about. It basically works by increasing your circulation, so it's going to make skin vasculitis more obvious, but it doesn't make your disease all that much more active, and it's normally something that will go away in a day or so. If you do decide to drink, there's a bunch of recommendations I got for you. And the first one is don't drive, and don't get into a car with someone who might have been drinking. Make sure that you hydrate. One of the reasons why people have such a bad time with alcohol is because they're just drinking alcohol and they're not drinking water, and it's probably the cause of hangovers. Remember to eat, because food is going to decrease the rate at which that you absorb alcohol. Remember to get to know your own body and your own tolerance, and this is particularly important when you're thinking about a 5'4" woman versus a 6'4" guy, that the 6'4" guy is going to be able to drink a lot more alcohol, and if you're that 5'4" woman, you just have to remember that if you're trying to match drinks. Remember to slow down initially, because you're going to be drinking and you're going to think this is not such a big deal, and then half an hour later it's all going to hit. So you have to make sure that you keep that in mind when you're thinking about drinking for the first time. It's good to be with one sober human being. Not everyone that you know is going to want to drink, and that person would be a great person to have around, and you can even rotate responsibility just to make sure that someone's looking out for you. And in the same way, you should look out for your friends. If you see someone getting into trouble, make sure that you help them out. It's not necessarily something they're going to remember, but it's the right thing to do. If you're going to use alcohol and you're going to use drugs, for the love of God, just don't use them at the same time, because it's really hard to predict how these drugs are going to interact, and it's one of the reasons why college kids get into emergency departments. This last piece of advice isn't even mine, but I think it's great. Take a phone charger with you. Just stick it in your pocket or your purse. And the reason why is because at the end of the day, if you need to get out of the situation that you're in, Uber is your friend. And if your phone is running out of juice, which it will be towards the end of the night, you might find yourself a little bit stuck, and that's not a place you want to be. So just take a phone charger with you. It'll be just a little bit of extra backup to make sure that you always have a choice. This advice actually comes from this particular website, which I thought was another great resource and would be something else to read before you go to college. There's some other stuff I want to talk about too, and I realize I'm going over, so I'm going to go through this a little bit quickly. For piercings, remember that if you get something pierced, that you got to be real careful about the care that they tell you to give afterwards. They're going to tell you to clean the area with alcohol, to keep it clean and dry. All that stuff's real important, otherwise it's going to get infected. When you get something pierced also, you want to make sure that you use a single-use item. You don't want them to pierce you with something that they've used previously on someone else. Regarding tattoos, you make sure that you go to a reputable place. You also make sure that you follow their instructions to the T, because nothing is worse than a tattoo that didn't heal well and looks all gnarly and scarred. Make sure that you ask them if they're using single-use vials. Anything that they use on you shouldn't have been used with someone else, and they should throw it out as soon as you leave. And it's one of the ways that you make sure that you're going to be safe and not infected. Remember, if you're on high-dose steroids, that it might make the tattoo heal funny, so maybe it's not the best thing for you to get. Remember that some people naturally form keloid scars. So if you're one of those people who gets a little bit of an injury and then you find that the skin swells up right afterwards and it forms this kind of bumpy scar, you're probably not the best person to get a tattoo. Finally, remember that tattoos are forever. So even though it may seem like a great idea this year to get a tattoo that says Free Brady, just remember that in 20 years it may not be such a good idea, and that getting tattoos removed is tough and not necessarily guaranteed. So to sum up, there's a couple of pieces of advice I want to give you. The first one is make sure to write it down. This is true for everything. Don't stick things in your brain. Write it down on a piece of paper so you don't have to worry about forgetting things. Don't be shy. Make sure that if you've got questions, you ask. You ask your doctor, you ask your parents, you ask your friends, you ask someone, but make sure that you ask someone who knows what the answer is going to be. Third rule is lean in. Now, this is an expression that became popular a few years ago, and it was something that we told women to do to make sure that they didn't hold back being worried about the consequences of their life and how it would impact them. And it's something that I think is important for college kids too, especially when you've got vasculitis. You've got to lean in. You can't be afraid of your diagnosis. You've got to seize the day. There's very little that you can do to make your vasculitis worse when you're in college. There's very little in terms of your experiences or your activities or whatever. And God forbid if something happens, that's why you got doctors, to catch you if you fall. And it's important to live life to the fullest and not to hold back and not to let the vasculitis rule your life. And that's the most important thing I have to say. And that's all I have. And I'm sorry for running over.
No, Dr. Seo, thank you so much. That was great. We will now turn the session over to Brittni. We just need to switch slides real quick. And there we go. And Brittni, you have the floor.
All right. Uh-oh. I have a black screen.
Okay. Can you see it's asking you to, let's say, click reopen to open the application again? Are you able to put it into slideshow?
That's what I tried. And it's spinning.
Kaylin, can you pull it up on your laptop?
Yes, I sure can.
Okay.
Let me go ahead and close some of these windows and we'll switch presenters.
Okay. So I wanted to congratulate Brittni. She started a new position today. Brittni, can you say a few words about that?
Sure. I just started. I got a new graduate nurse position at Greater Baltimore Medical Center in Towson. I'm going to be working full-time and also going to school to get my bachelor's degree.
Great. And you had orientation this morning?
I had orientation this morning, and I start full-time orientation next week.
Okay.
Yep.
How many will you be working with?
I will be working with approximately 15 other new grad nurses.
Wow, that's great. And are they from all over the country or local or?
They're local. They work on other units at GBMC. It's a new cohort they're starting. So I'll be working with new graduates.
Excellent. That's excellent. Well, congratulations first on graduating earlier this year and now on your new position. And thank you so much for participating in today's webinar. We know you were juggling a lot. And it looks like Kaylin, are you able to see Kaylin's screen now, Brittni?
Yes.
Okay, so if you want to just have Kaylin advance the slides for you, that'll work great.
Okay.
And I'll mute myself. Thank you.
All right, so hi everyone. Welcome to the vasculitis webinar. As they said, my name is Brittni Riemer. I hope you find Dr. Seo and I as helpful as you manage your vasculitis. Vasculitis, as any other health diagnosis, has its ups and downs, which brings me to my presentation, the ups and downs of life with vasculitis. Okay? So this is just a little bit about me. I won't read every bullet, but I have been a former cheerleader of 10 years, both in all-star cheerleading and high school. I have attended a technical high school for nursing, and I graduated in 2010 with nursing assistant certifications. I've been a med tech for 2 years now. I've worked with elderly population and also children. So I've been working in healthcare since I was 18. I've been exposed to practically anything and everything. So I get every immunization possible. And I get sick maybe once a year, thankfully, mainly due to stress because I'm very busy with school. I'm very active in my community. I love to donate my time, donate gifts. I volunteer. Let's see. I've attended Hartford Community College. I graduated this past May as a registered nurse, and I start next week, actually, at Notre Dame for my bachelor's degree. Okay. So my diagnosis, just a little bit about it. I was diagnosed with microscopic polyangiitis at the age of 13. I was just finishing up 7th grade in middle school. That was April of 2005. I was put in the intensive care unit at Johns Hopkins Hospital for 1 month and had the pleasure of meeting Dr. Seo, and I've been working with him for 10 years. My diagnosis began my passion for nursing. And since 2005, I've had one flare-up in January of 2010. That was 5 years after I was diagnosed, and I was in the hospital at Hopkins for 3 days. I believe my flare-up was from a change in medications. We were kind of doing a trial and error. And since I knew signs and symptoms of my diagnosis, I was getting shortness of breath, tired. I had a dry cough. I knew that something had changed and something wasn't right. So I had immediately went to the hospital where I was admitted for 3 days. And because they knew my diagnosis, they knew what was happening, they started me on prednisone right away. Not as high doses as I was in the beginning for my diagnosis, but I was on prednisone again. So I caught it early enough that we could treat it not as heavily. So middle school, when I was diagnosed, it was kind of the prime time of, making friends, fitting in. It was very difficult coming back to school after 1 month of being gone. Rumors flying, different people talking about me, and I came back and just had the positive attitude, as Dr. Seo was saying, just staying positive and telling people in simple terms, what I was dealing with, and once I came back in 8th grade, kind of knew who my friends were, and kind of stuck with those friends for the remainder of middle school. And I don't know if you've heard the saying, but I'd rather have 4 quarters than 100 pennies. I'd rather have 4 close friends, 4 that know me, knew what I went through, than 100 pennies where it's just another friend and they don't know what you're going through. They look at you as a person on the outside and not necessarily what's deep down. Okay, so prednisone. I was on high doses of steroids when I was first diagnosed in 2005, and within months I gained 60 pounds. It is a bittersweet word. Prednisone calms the immune system, and it also adds horrible side effects. So within a year of being put on prednisone, I lost half of the weight. I was very active from cheerleading. Prednisone has made my bones very brittle, as it will many others, and since I was still a teenager, my body was still developing, still growing. So them being very brittle, I've broken 4 bones since my diagnosis. I was tapered off of prednisone within months, as many of you will be, and I lost friends because of my weight gain, but as I said before, my true friends stayed. So my tip for prednisone is to be active. Be more active, especially first few months after starting prednisone. Yes, it will make you tired, and some days won't be your best days, but still make the best of it. Be active, just be fit. Most of the weight that you gain is water weight, so sweat it out. All right, this is a before and after picture of me. This was 7th grade before I was diagnosed. Very thin, very pale. I was very, very sick before I didn't even know it. Was put in the hospital, and then this was about a year later in 8th grade, the moon face with the prednisone and weight gain. But I was the same person on the inside, just physically I was different. All right, how to cope. So I always remind myself that I generally lead a normal life, a healthy lifestyle, but may have bumps in the road just like any other human being. I physically do not have a disability, so, walking around with one arm or, being blind, something that people notice, it's different and you handle it differently. You're just like any other person, just you have a internal condition and you deal with life challenges just like everyone else. So the hardest part of this diagnosis is when it actually first occurred. You have a flare-up, which requires higher doses of steroids and changes your physical appearance. Understand that you are one of a kind and you have to tell your story and explain your diagnosis. It is important to talk about your feelings. You don't want to bottle them up. It is okay to seek out a counselor if you need someone to talk to. I've actually had to do that in the beginning of high school. I went to see a psychologist just as someone to talk to other than my parents, because as Dr. Seo mentioned, someone that will listen and talk to you, and they won't just say, oh, but you still look beautiful. You just want to get your feelings out, and someone that will actually help you. And she actually helped me. It is important to talk about, talking is important, but the diagnosis isn't like cancer. People don't necessarily know about it, and they don't understand it enough to know the right words to say. So, they try to help and talk you through it, but it's different when no one truly knows what you're going through on the inside. It's hard to educate someone when you're still learning yourself. I mean, to this day, 10 years later, I'm still learning about, my diagnosis. There's something to learn every day about it. Things like I donated blood at one point, and something as simple as they didn't know about it because it's not common. So they went through all of this trouble just to find out if I could even donate blood, and thankfully I could, but they thought it was contagious. They thought it was just this huge thing and I was going to infect other people, and I wasn't. Once people really know your story, it gets easier from there. They don't ask a lot of questions that much anymore, other than how have you been? So in the beginning it's a little difficult, just making sure everyone's on the same page, and they only know as much as you tell them, so it kind of is based on you. So my family's role, they are my biggest supporters, my parents and my sister. They have never left my side in the hospital. My mom goes to every vasculitis-related appointment. Different than what Dr. Seo had said, my mom stays with me in the room. She knows basically everything about me, so nothing I really have to hide or I'm afraid to ask in front of her. I actually believe it's better to have her in the room with me. This is my situation, but I believe that 2 sets of ears are better than just one. Sometimes she'll have her own input, she'll have her own questions, opinions, and it actually is stuff that I've never thought about before. So I look at it as a positive thing that she's there to help me. All right, so then I have a slide on how to organize your new life with vasculitis. I do this myself. I keep a binder. I actually keep a spiral notebook, but I make a section specifically for my doctor's names, their specialty, and contact information. I have many doctors that I see. I see Dr. Seo, I see a kidney doctor, ENT, I have a primary care physician, and things other than vasculitis. I have a dermatologist, a dentist, eye doctors, and then for females, an OBGYN. And also it helps keep everyone in the loop when you have a list of everyone. So you want to make a page for upcoming appointment dates and times. Add it on your calendar so you don't forget, especially when you start not seeing the doctors as often when you're in remission and it's just management of your diagnosis. You see them once every few months, once every 6 months, once a year. It's very hard to remember, so always write things down. Make a section for questions or concerns. In between each doctor's appointment, jot down any questions or things you feel you need to bring up at the next appointment. Some appointments could be 6 months, as I said, and you may tend to forget. I also want to make a section for your medications. Write down information about your medications and the changes in the dose or frequency. I know especially in the beginning, I've never taken a pill in my life, and then diagnosed at 13, I was taking close to maybe 10 pills, not necessarily 10 different medications, but multiple pills. And it was hard just to keep up with what I was taking when, how many pills I was taking at a time. So just by writing it down, you can visually see, and also helps you remember what to take and to keep things on the right track. So there's basically no sugarcoating this diagnosis. It is difficult. I missed a month of school, lost friends, I had to buy new clothes because of my weight gain, keeping track of medications and treatments, those that worked and didn't work, and keeping everyone in the loop. Despite facing these challenges, though, I believe I've come out a stronger person based off of it. It's molded me into who I am. I couldn't be more thankful for it. It's, as I mentioned in the first slide, I've become a registered nurse. Being in the hospital, it's changed my perspective on life, and you never take anything for granted. I've learned just to stand up for myself, especially when I came out of the hospital. You just had to necessarily put people in their place when they've said things that they shouldn't or isn't true. So I've just learned to stand up for myself, and I've just been stronger because of it. So my final thoughts on this diagnosis, no matter what role you play, it's a difficult time to go through a new diagnosis and balance life's roles and challenges. It's a confusing time, no matter what age, as you are learning about your diagnosis as well as others around you. Not everyone will know the right thing to say, but stay positive. They're doing their best to support you. Stay hopeful. Not all treatment methods will work. I've tried infusions. I've went once a week, every Mondays, to get an infusion, and my body didn't necessarily tolerate it well, so I had to then switch to another medication. So it's in a way about trial and error. Not necessarily error, but just things that your body doesn't like or won't handle. So you just have to stay hopeful, know that, you know, your doctor's working with you the best they can to keep you in remission and so you don't have a flare. And ask questions. You want to be familiar with your diagnosis. As Dr. CEO and I have stated many times, you will be educating a lot of people, even doctors. It's very, very rare. So I guess in conclusion, I hope that you guys have benefited from Dr. CEO and I's presentation. If you guys have any questions, we'll try to answer them to the best that we can. But we just hope that you can, deal with vasculitis in your own way and seek out help when you need to. So thank you.
Great, Brittni, thank you so much. We really appreciate your presentation and sharing your experience and your thoughts and your suggestions. I'm going to turn the question section. We're running a little over, but we're going to go a few more minutes over. We have a few questions that have been submitted, so I'm going to ask Kaylin Young, our network manager, to coordinate the Q&A session. So Kaylin, do you have some questions that have been submitted? I put some in the chat box that were submitted by email.
So the first one that was submitted via email was actually about a 504 plan, and if students should get a 504 plan, even if they're in remission, just as an extra buffer, I guess. And so for those of you who don't know what a 504 plan is, it falls under the section 504 of the Rehabilitation Act of 1973. And it can help students with learning and attention issues learn and participate in general education curriculum, and it kind of gives you, it outlines how a child or a student, their special needs, and if they need any special accommodations for that, or for their disability or needs.
Yeah, I'll take that, of course. I generally don't recommend filing for a 504 plan because in my experience it just really hasn't been necessary. My job is to try to keep the student in remission while they're at college, and if I can do my job, typically they won't need something like a 504 plan. I'm afraid that when my patients have flared and it's been serious, they've actually had to drop out for a semester, which means that they also don't need a 504 plan for that because they're just out. So it ends up being a little bit binary for me. I'm sure there are situations in which a 504 plan would be useful, but if someone's doing well and there are no medication changes planned, I wouldn't think a 504 plan would be necessary.
Okay. Great, thank you so much. So this question is actually for Brittni. When you went to medical appointments with your parents, were there times when you wanted to ask a question that you felt was awkward? And I know you touched a little bit on this at the end of your presentation, but were you ever confronted with that situation where you just felt awkward asking?
Honestly, I hate to not be help here, but I've always had my mom in the room. I've never had a question really that I was embarrassed to ask in front of her or been awkward. I know as a nurse I was taught that you can ask, patients if they want their family members in the room during their assessments or history. So that's always an option, but I've honestly never had to ask my mom or anyone to leave.
So I guess the follow-up to that, thank you, Brittni. I think my personal follow-up question to that is for Dr. Seal and Brittni. Do you have any recommendations if you have patients that would like to ask their parents to leave the room but don't necessarily know how? Do you have a nice escape route that they could utilize?
Well,
I would say body language maybe. Like I would look at my mom and just kind of give her the eye, like, can you leave? I mean, I would say too, but I don't know. Dr. CEO, do you?
yeah, I agree. There's a whole spectrum of relationships and families, and it sort of depends on your relationship with your parents. Now, I will say that Sometimes what Brittni described would work with some parents. That would never work with my parents, who would never take a hint like that. And I would say in the worst case scenario, you can always just call. And I'm happy to talk to you over the phone, and you're the patient, and whatever you tell me, it's not, unless you're going to go postal or something, I'm not going to communicate it to anyone else. And you can feel free to ask questions that way. And I think for sensitive subjects where you feel uncomfortable talking in front of your parents, I think that'd be fine.
Okay, great. And again, I just wanted to remind everyone, if you have questions, please submit them via the chat box on the navigation bar. There's a little question section and also a chat section where you can type in your questions, and I'll receive them on this end. And if there are any, since we are running just a little bit over, if there are any questions that are more specific health questions or questions that we can't answer on the webinar, I will make sure to email those to Dr. Seo and Brittni and see if we can't receive a response or at least a recommendation for where you can find materials that might answer your question.
Kaylin, I just had one come in through email. They wanted to know, Dr. Seo, do you recommend, how do you transition patients to ordering their own medications, handling things like that? Do you encourage that when they're in high school or college, or is it, what are your thoughts on that?
I think I encouraged Brittni to do that when she was 12 years old. One of the first things that we did was we went through her medications. I think that earlier is better, and just because whenever I meet someone who is, say, in middle school, I know the clock's ticking. I know that a lot of them are going to be headed to college, and there's a limited amount of time where I can get them comfortable with the diagnosis and the medications. So I think that it's individualized, but I think that it's never too early to start transitioning responsibility.
Comfortable with that when you were 12, 13? Were you on board for that?
I was. I was still young, so a lot of this was kind of Spanish to me. But over time, I've, learned about it and just learned to definitely ask questions when I need clarification.
Great, thanks.
I just think it's important to learn early on that, especially for a student, that it's their diagnosis and it's their body, and that they need to take responsibility for it. And like I said, everyone does this at their own rates.
Mm-hmm. So here's a question about rituximab. Do you recommend, if a patient is doing rituximab, do you think they should go back home to have the infusions, or do you think that's something that can be handled by the health center on campus?
So the issue with rituximab is that not every infusion center is going to be comfortable taking an order from a physician that they don't know. So in a lot of cases, it's just going to be a lot less hassle if you just get the infusions done when you come back for vacation. I think there are some exceptions, but I think that getting a college to handle a rituximab infusion would be very difficult.
So this is a question that came in through our chat box. Does my son has serious sleep issues due to prednisone? Do you have any suggestions? Lack of sleep and stress as well as hospitalization caused him to fail the second semester of his freshman year.
Yeah, that's tough. Prednisone has a serious impact, and certainly the first suggestion is try to get him off the prednisone, but I'm sure that's been a long-term goal. I think the second thing I could recommend is make sure that you're not splitting the dose of prednisone, making sure that you take it first thing in the morning as early as you can to try to get the side effects wash out of your body. Third recommendation I've got is about sleep hygiene. Make sure that you don't take naps during the day, making sure that you don't put up your feet for like 10 minutes and take a little bit of a break. And the reason why is because the more of the breaks that you take during the day, the more your body gets accustomed to these little tiny breaks, and it's harder to fall asleep towards the end of the day. I would say that if it gets to it, there are also other things that you can try. There is a meditation tape that's pretty popular on YouTube. It's not that hard to find. You're supposed to play it when you're falling asleep, and it actually has helped a number of my patients.
That's excellent. Thank you. So those are all of the questions that I've received. Joyce, did you have any others via email?
I don't. I just checked and I don't have any more. But as Kaylin said, if you have a question that you didn't get answered today, please feel free to email us and we'll try to get some sort of answer for you. At this time, I know we're running over, so I would just like to thank Brittni and Dr. Seo for your time. Thank you so much for sharing your knowledge, your experience, your thoughts, your suggestions. We really appreciate it. I also want to thank all of the attendees for participating. We did record the session, and so we will be making it available in the webinar library. And we record all of the webinars, and they're all stored in the webinar library. So if there's an earlier webinar that you didn't get to see, I encourage you to go out and check out the library and watch the webinars. We will be having webinars in September and October and November. We already have November set. Dr. Swahala from the University of Michigan will be giving a discussion, will be leading a discussion on genetics. But again, I'd like to thank Dr. Seo and Brittni and all the attendees for participating. And Kaylin, thanks for your help today, and I hope everyone has a great week.